Welcome back to the What the FUE podcast. As some of you may know, here at Want Hair, we partner with a few different hair loss treatment companies, one of them being 360 Optimum Hair, which is owned by the lovely Sophie, who we have with us today. Hi, guys. Hello, everybody. Sophie also owns her own 360 hair clinic as well. Some of you might have seen her on TikTok and Instagram. She's known as that hair loss expert in the famous blue tunic. So that you might have seen her on there. Today we're just going to have a little bit of a chat with Sophie, talk about her experience. She knows a lot about hair and hair loss. So yeah, we're just going to chat to her today and find out a little bit more. So, Sophie, if you start off just by telling us a little bit about you and how you got into the industry, how long you've been doing what you're doing.
Okay, so I've been a hair loss consultant for just over 13 years. So when I opened 360 Hair Clinic, I actually opened only offering low-level laser therapy.
Oh, okay.
So there was this only treatment that I was offering for a period of time. I then very quickly started working with hair transplant surgeons. So I've probably been working with hair transplant surgeons for about 11 years, perhaps.
Yeah. So you know what you're doing.
Exactly that. Yeah. And at the time, I wasn't so involved as I am now. It would simply be making sure I had another company that I was happy to send people off to if they wanted to explore surgery. Yeah. Then I would say shortly after Want Hair launched, I was introduced to the founder. And at the beginning, it was just me and him.
Which is crazy, because like now we have such a big team and it's crazy to think that it was just you guys at one point.
Yeah, exactly that. So he was obviously doing the bulk of the consultations.
Yeah.
It was his business. I have my hair loss clinic and I would really just do some of the overflow of the consultations, or if there was something a little bit complicated of maybe having to establish what the cause of someone's hair loss was.
Yeah, exactly. And it's good that sort of Shami obviously knows what he knows, but then you're in the industry almost on like a different level sort of thing. So you can help with what he wouldn't have known about.
Exactly that. Yeah. So the partnership just formed really organically.
Exactly.
And it grew. Since then, my clinic has expanded. Obviously, Want Hair has grown substantially, and we've always remained working together as partners.
Which is lovely. It's nice to keep that relationship.
Exactly that. And I really trust that any surgeons that Want Hair seeks out to work with, I'm always kept in the loop.
Yeah, exactly.
I am really confident that great surgeons are always chosen and the level of service is always going to be great. And it means that I can do the bit that I enjoy, which is the consultation, seeing patients in clinic.
Yeah, chatting to people.
Exactly that. And then I know that the rest of the process is going to be taken care of in really good hands.
Yeah, exactly. So do you have people come to your clinic for like a consultation? Or do you do them online or over the phone as well? Because we mainly do our consultations over the phone. So do you get a lot of people coming to you in person?
Yeah, I do. I get a complete mix, if I'm honest.
Yeah.
So obviously if they're local, it's a no-brainer to come and see me in clinic. However, I've got lots of patients that travel. So some of them might come in once every month, 3 months, 6 months for something like PRP. But if they are just using home treatment, hair loss medications, or if they're just booking a surgery, it might all be done over the phone. Or it might be the initial consultation is over the phone and then it moves
and then
on
they
to
can
seeing
come
them
in depending on. So your clinic is in Brighton, is that right? Okay, yeah, just to let everyone know if they ever want to visit, it's in Brighton.
Exactly that.
So I actually saw my first hair transplant surgery happening on Monday, just gone. How many have you seen?
I think, so over the past 11 years, I've sat in on maybe 10 or 11, I think.
And it's a crazy procedure, isn't it?
Yeah, I love being in surgery.
Yeah.
I find it fascinating. And obviously when surgeons are happy to kind of open the doors and allow you in to that experience, it's
I guess
amazing.
That's better for you as well because you can see it hands-on.
Yeah.
Because I feel like you can watch videos and you can sort of like hear people talk about it, but until you see the surgery happening, you really have no idea.
I know.
Like,
I mean,
what
how
goes
did you
on.
feel? So in the build up to going to my first surgery, I was on the train. I was heading up to Manchester and I thought, oh, what if I faint? It's never really dawned on me that I've never seen anything like this before.
No, me
am I
neither.
okay with blood? I don't really know if I am.
Yeah, people say that. Are you okay with blood? And I'm like, well, actually, I'm not sure. I don't know because I've never seen it.
No, exactly.
Yeah, it was interesting.
Yeah.
It's a longer obviously I've been with Want Hair since August, September last year. So I know a bit more now than I did, obviously. Before I started with Want Hair, I had no idea how the process even worked. For me, it was like, it's crazy how long it takes.
I know.
You
Yeah,
know?
it's a long day,
It's
isn't it?
not just a couple hours. Like
No.
it's, 6 to 8 hours length of surgery.
Yeah.
But they're so careful and that you've got to be so precise. So no wonder it takes that
So
long.
you're sort of tiptoeing around, just don't mind me,
Yeah,
I'll stay out of the way.
Exactly, because we were there with our videographer for filming and for like a client testimonial, and we're there like trying to be quiet, sort of walking around, and they're just like doing their thing. But it's so interesting to see.
It's amazing to witness, isn't it?
So
and I
interesting.
found in my first surgery, it just really kind of tipped me back that it almost doesn't seem like it's real anymore. The skin, the tissue almost looks like plasticine, and you kind of just almost looks like a science.
Yeah, like you're watching science. Yeah, exactly.
Really interesting, fascinating though to be part of it. So yeah, I really enjoy being in surgery. I have thought numerous times over the years of whether I might train to be a hair transplant technician.
Yeah.
Because I would love to support in surgery, but we're so busy in clinic, I just don't think I could take time
you wouldn't
out
have
of
time
clinic.
to do it.
No, I don't think so. It would be just like as a hobby almost.
Yeah,
which I just don't
sounds
really have
silly,
time
but it's
for.
also like I don't have time to train to be a hair transplant technician just for fun.
Exactly. Yeah, and taking myself out of a day of
but
appointments.
it would be cool. Like it's another thing to learn how to do. So it would be cool to like have that under your belt. But I mean, I don't know, how long do they train for?
I've actually got no idea.
I wouldn't
a lot
know.
of
I don't know if it's
train on the job.
Yeah. Well, I guess that's the only way.
Yes.
It's not classroom type of stuff, is it?
No.
I mean, you can learn sort of the, what's the word? Like the science behind it, like the biology or whatever.
Yeah.
But you need to be
there's the procedure
surgery
on paper,
practice.
but there's so many things that can change in surgery where they have to adapt what they're doing. So
Exactly. About the hair loss treatments that are offered at your clinic. So if you just give us a bit of an overview and then we'll sort of dive into them a little bit more in depth.
Perfect. So when I opened 360 Hair Clinic, it was always really important to me to be able to offer everything that's available.
Yes.
So in clinic, we offer low-level laser therapy. So I actually opened the clinic with a laser.
With just that?
Yeah,
so that was the first thing that you,
Exactly that. And then we also offer Solenis PRP therapy, phlebotomy, so private blood testing.
Okay.
Intramuscular vitamin injections.
Oh, wow. There's loads.
Yeah, scalp micropigmentation. So
yeah, I know that one.
Yeah. I'm partnered with a pharmacy, so we can offer oral and topical hair loss medications. And then the 360 Optimum hair products as well.
Yes, which is your
Is.
brand.
Yeah, absolutely.
Okay, fab. So let's dive into PRP then. So what does PRP stand for?
PRP stands for platelet-rich plasma.
Okay.
So essentially when we do PRP, so we take a sample of blood, so it's just like having a blood test.
Yeah.
And then it is spun in the centrifuge. So it spins it at such a high force that it separates the different components of the blood.
Okay, lovely.
So the different components of the blood have essentially got different weights to them. And when it's spun at force, they separate out in order. So when you see a PRP tube, everyone knows the kind of yellow and the red split in the tube. So you've got your plasma and you've got the red blood cells as well as other things, inflammatory parts of the blood, etc. So what people don't realise is that yellow liquid, the plasma, that also contains your platelets. But most of those platelets are actually right at the bottom of that sample.
Okay.
So essentially, depending on what system is being used, it could be a high concentration platelet-rich plasma, or predominantly it could be platelet-poor plasma.
Okay.
So really there should be something that makes it very easy for a patient, a client, to understand what kind of PRP they're getting. But effectively, they're all called the same thing.
Right, okay. Makes sense. God, it's confusing. Like, as someone who didn't even know like anything about hair transplants, I hear PRP and I'm like, now I know the word, I see it everywhere. Like all over TikTok, so many people talk about it, so many like clinics do it, and it's just crazy. I'm like, I didn't even know it existed, and now I see it everywhere.
And it's used in skincare. I've got orthopedic surgeons use it for joints. knee surgery.
So how do they use it in skincare? Like, how does that work?
Exactly the same. So they harvest the platelet-rich plasma and it's
Okay.
injected into the skin. So it can be microneedled. It could be what I do in the scalp. So
that makes
subdermal
sense.
injections, to rejuvenate and regenerate.
Interesting. So we're getting technical now, guys. We're getting the tubes out.
Okay.
Okay, so this that you have in your hand, that plastic thing, what's that?
These are blood collection tubes.
Okay.
So these are used in a blood test. So if you went into your doctor's surgery, hospital, the different colour on the top signifies what they're testing for.
Okay.
So there are different ingredients in the tube, sort of anticoagulants.
So that's what's at the bottom there.
Exactly. So yeah, the gel or the liquid inside the tube will be there to change the blood sample in a way that it will be tested for whatever they're looking for.
Got you.
Yeah.
Mm-hmm.
So as you can see, how I've arrived with these today, this is how I get them. They're loose in a box, so they're not sterile. You know, there could be any level of like bacteria,
Anything could
virus,
have got
anything could be on that entrance. Also, the most important part that I try and educate people on PRP is that these ingredients inside the tube have never been tested to see if they are safe to re-inject that blood sample and that plasma you've created back into the body.
Right, okay.
So we have no way to know if it could cause a toxic response, an allergy, an illness, trigger an autoimmune.
Yeah.
There's just nothing to say either way.
Nothing to say that, there's evidence of, if
exactly
it being
that.
tested.
If somebody is booking in for PRP and they're seeking to have it done, the amount of phone calls we get in clinic, the first question is, hi, how much is PRP? So I'm like, well, stop right there. That is the last question you should be asking me. The first question you should be asking is what tubes and what system do you use for your PRP?
Okay.
Because
that's is that like the most important thing?
So important. Like you should know what is being re-injected back into your body, just like you would check a brand of a medication or you would check the ingredients of a supplement. Yeah.
Yeah.
So that's super, super important. If a company doesn't know at all, that is a bit of a warning sign because they could be using anything like this. I see videos online, particularly on platforms like TikTok, where tubes like these are being used for PRP.
Right, okay, yeah. So you've seen people use these.
Which is wild to me because if they're sharing it online, they must not know that it's not okay.
It's not okay.
Yeah.
Okay, so you would recommend if somebody is trying to look for a clinic to have PRP at, you would recommend them to ask these questions.
Exactly that.
Before anything else.
Yes. What brand of tubes are you using and what system do you use?
Okay.
And they should be able to tell you that. Second thing to ask would be maybe to find out the platelet dose and how many syringes of PRP you're going to get. Okay. So if I just pop those down. Going back to the Solenis tube that I use. So this is a 22 ml blood draw.
Okay.
This means that once it's centrifuged and the yellow plasma and the red is separated, we're going to end up with roughly 11 to 12, maybe up to 13 mil of yellow plasma. So going back to what I was saying earlier, although there's that much plasma, if we were to use all of it, it would actually be platelet poor plasma because it would be very diluted.
So you're going to
have the plasma and then you're going to have the platelets right at the bottom.
At the bottom, yeah.
So a system like this, there's a few benefits that make it like a higher strength PRP. The first one being there's a special coating on the inside of the tube that doesn't allow the platelets to stick to it.
Okay.
Which again, with basic tubes, this happens a lot. So you're pulling yellow liquid out, plasma, but it doesn't have many platelets in it.
Right.
Second of all, just the technology inside the tube means that it's actually drawing about 97% of the platelets out of the whole blood sample. So that could be compared to like a basic tube that only pulls out about 30% of them. This is 22 mil. Basic PRP tubes are 8 to 10 mil. So it's less volume to start off with. And then what they will end up doing is using all of that yellow liquid.
Yeah, yeah.
So we're going to get a high volume of plasma at the beginning. We're then actually using this as a completely sterile closed system. So the rubber bung on top means that I can pop a vent needle in. I put a long drawing up needle inside, so that lid is not coming off at all.
Okay, yeah, so it's on, so it's
keeping it sterile.
Safe. Yeah.
I then remove the top, could be from 5 to 8 mil of platelet poor plasma. So we're left with less liquid to dilute those platelets.
Yeah.
And then it's called inverting. So I'm basically very carefully, without damaging the platelets, inverting the tube to mix the platelets into less liquid.
God, it's a real
Like a science experiment
science experiment, isn't it? Yeah, I had no idea there was this much like science to it.
Well, it depends how it's been prepped, because basic PRP tubes, so you've got blood collection tubes, 100% no, not safe.
Okay, yeah.
You then have
Big no.
Yeah, you then have basic PRP tubes, which will create, it's safe, so it's blister packed like this, it's sterile.
Yeah.
Smaller, lower platelet count, but it's still not going to cause any harm.
No, it's still safe to use.
Exactly that. And then you get systems like this that yield, you know, the platelet count is going to end up being maybe 4 times the strength of a normal PRP.
Okay, so they're the better option, but are they more expensive?
Yeah, they are, absolutely.
Yeah, okay.
Yeah, absolutely. The equipment's more expensive. Yeah. So, you know, in my clinic, we just use the best of everything.
Yeah. No, that's good to know for like people watching, that you're using the best of what you can get, because at least then you know that, you know, you're most likely going to get a better outcome than using anything else.
Yeah, and that's so important to me. So when people kind of ring up and say, oh, I can get PRP for £150, I'm like, well, that's great, but I can't even buy 1 tube for that. So what is the quality of the PRP?
That's it, because I think with everything in life, no matter where you go, people always say, oh, well, I can get it cheaper. Okay, but cheaper doesn't mean better.
No,
so
exactly.
Let's start there.
Yeah, so the outcome is significantly better with something like this.
Right.
And PRP can be, you know, microneedled. You might see online videos of like mesotherapy guns.
What's that?
So it's literally a gun that kind of shoots the needle in really fast. So the injections go in like, really quickly.
Yeah.
I personally choose, it's slower, but I personally choose to do subdermal injections by hand.
Yeah.
Because it goes in a bit slower, but then it doesn't squirt back out again.
Right, okay, it's all... So how long is the process?
About an hour, I would say.
Okay.
So blood draw within a minute or 2.
Yeah, that doesn't take very long.
Exactly.
Yeah.
It takes 10 minutes to spin. Whilst it's spinning, I normally take photos in clinic so we can track progress.
Yeah.
Preparing the plasma takes a while. God, I wouldn't even know. 10, 15 minutes.
Okay.
Because when I'm removing the weak part and I'm suspending the tube and I'm drawing it out into my syringes.
That's probably the part that takes the longest.
Exactly that. And a lot of patients like to watch that part. If they're okay with needles, it's really interesting. I can literally show them the stronger part and you see the PRP turning cloudy.
I think I'd want to watch.
Yeah, exactly that. So that's quite interesting. And then the injection part, maybe 15, 20 minutes.
So it's not like it's not a long, I mean, it's definitely not as long as getting a hair transplant.
No, exactly that, exactly that. And also, if somebody has had a hair transplant before, it's really important to note that the needles are nowhere near the same as what you have with local anaesthetic in hair transplant surgery.
Right, okay, yeah.
So in surgery, the needles are longer and thicker. They have to get a lot of liquid into the scalp.
Yeah, they do, because the whole scalp has to be numbed, doesn't it?
Exactly,
So,
and anywhere that local anaesthetic doesn't touch won't be numb. Yeah. So local anaesthetic, lidocaine really stings. So with the PRP, number one, it's called a 30 gauge needle, really, really fine.
Okay.
And it's only 4 millimeters long.
Well, that's not very long.
Really short, tiny, and what we're injecting isn't at the same pH level to sting in the same way.
So it would never hurt even if it was...
No, I mean, some people find it a bit uncomfortable.
Yeah,
but then it's not pain. I've had PRP done loads. It's not painful, like really, really painful.
It's
nothing like
same
local
with
anaesthetic.
Like a hair transplant though. So many people say that those injections don't bother them.
I know, yeah. A lot of people are like 4 or 5 out of 10. Other people will say...
Oh, they say it's like the most excruciating pain ever. Yeah, because we were, when we were doing the filming with one of our clients on Monday, I was like preparing myself like for him almost. It'd be like, right,
some screaming.
Like, are you ready? Like, it's coming. And he was absolutely fine. He was like, oh, I've had tattoos. Nothing on getting a full sleeve. And I was like, oh.
Yeah, it's funny how everyone can be so different.
So different. It's crazy. Because you would think like the scalp's a very sensitive place.
Yeah.
So you would just think, oh, it's going to hurt everybody. But I think that's one thing that puts off a lot of people.
Yeah, and it's a shame. But also it's kind of just a few minutes. Let's get it in.
And then this short-term pain, long-term gain.
Exactly. Yeah, exactly that. But with PRP, so I use like a little vibrating device, like a face massager that I hold next to all the injection points, and it distracts the nerves.
Yeah, that's good, because then they're kind of, and also like you can hear a sound as well, so you're sort of thinking, oh, it's not
Someone
that
asked
bad.
me on Wednesday when I was going to start the injections, and I was like, we're on the last syringe, and he went, oh, I thought you were just prepping my scalp with a vibrator.
He didn't even realise that it was happening.
I was like, no, we're nearly done.
Oh, that's good then.
Exactly.
Good experience. Tick. Yeah.
So just to summarise then, so when we harvest the platelet-rich plasma into the syringes, we're injecting it into the scalp to a depth of, 2 to 4 millimetres, so it's really superficial. When we do that, the platelets release growth factors, and they will regenerate the hair follicle, they heal the tissue, they grow new capillaries, so we're actively growing more of a blood supply to the follicle. So it's amazing as a standalone hair loss treatment, whether someone's having hair transplant surgery or not. In an ideal world, I mean, if there's time and there's scope for it, it's really nice to do pre-surgery to prep.
Yes, that's quite common, isn't it, to get it done before they had the hair transplant surgery. So how many sessions does it take to sort of, or how many would you recommend? Sort of, either if you're having a hair transplant or not. So let's start off, if you don't want a hair transplant, you sort of just...
getting the hair loss stable.
Because a lot of people will go to that first before they go, oh, do I need...
I mean, and it's also the best way to do it if we can. If we have time... and there is at least 3 to 6 months pre-surgery, the best thing you can do is stabilise the hair loss ahead of having surgery, because then we're not working out which hair loss treatment works for you after the surgery. And in that time, you could continue to recede, the crown could continue to open. So, I mean, with any hair loss treatment, I would say it's going to take 3 to 6 months to start to see progress.
Which is not actually that long.
No, it's not. And it's a time frame that people normally, if they've got their surgery booked, and they normally have a bit of time. So with any hair loss treatment plan, we can kind of categorise people into a few different categories. Say that. So you have somebody that is in very early stages of hair loss and thinning, and they're using hair loss treatment to just get their hair loss stable, but they haven't lost enough hair where they need a hair transplant. You then might have somebody that has significantly receded or the crown's opened up. So we now have balding areas, and they're going to need hair loss treatment to stabilise the hair loss from that point. And they might regain some density, but no hair loss treatment alone is going to
completely restore. That's one of the things I was going to ask. So if they are at that point and they have balding areas, the chances of them in 6 months' time having 4 thick hairs in that area, like, it's probably not going to happen.
So in areas where the follicles have become inactive, they're not going to grow hair. Sometimes it can look as though the hairline has lowered a little bit or the crown's closed in, but it's because there were thinning hairs there that have now thickened and strengthened.
So like a thinning area can become thicker and have more sort of density, but if the hair's completely gone and it's completely bald, then...
Exactly that. So in that case, we've got 2 options here. Somebody might just use hair loss treatment to get their hair loss stable and to thicken it, but they just might not choose to pursue hair transplant surgery.
Because it's not for everyone.
No, exactly. And they might just be happy as long as they don't lose any more. In that same category, you then might have somebody that does want to pursue hair transplant surgery. So ideally, we get the hair loss stable, they have the hair transplant to fill in the areas that have become inactive. And they continue to use their hair loss treatment ongoing to ensure that it then remains stable and they can enjoy their results forever as long as they maintain. We then have another category where maybe somebody has lost a lot of their hair. So a significant percentage where even if we did a hair transplant, they're never going to have a full head of hair, unfortunately. If they've lost too much, there's only physically so many hairs that we've got, follicles in the donor area.
Well, it all depends on how strong your donor area is at the end of the day, doesn't it?
How large it is, how large the balding area is, how large someone's head is. There are so many things, how low they want the hairline to be.
There's like a really big surface area, and then you might have a donor area, but there's never going to be enough to cover what you think it's going to cover.
If we sectioned off the area we extract from, cut it and slapped it on top of the head, it's only ever going to cover so far anyway.
That's why it's so common that people just get their hairline done, isn't it? Like just the front section, because that's majority of the time what's going to cover it.
Exactly. And then we get a really good outcome long term as well.
Yeah.
So in that category, somebody still might explore hair loss treatment, but only if they are really aware and really realistic on their expectations. So for some, I've had patients over the years that almost just have like a scattering of hairs left.
Yeah.
But it's worth holding on to for them.
Okay.
So it's just whatever the patient is looking for. And again, if that kind of patient did look to pursue surgery, it's just completely managing their expectations on what they can achieve. So it might be a hairline to the mid-scalp with a very light covering of graft. So it's never going to be a full head of hair or a thick outcome even at the front.
Exactly. I think that's quite important to set for like consultants.
Yes.
It's important to set that from the beginning, because I think a lot of people who have lost a lot of hair do have the expectation that it's all going to be fixed and they're going to have as if they're like 18 years old again.
Yeah, it's such a shame.
Yeah.
I have, in recent months actually, I've got 2 people that come to mind that came in for a consultation and they were just told years ago, wait till you go bald and then have a hair transplant. It's such a shame, because if I'd got to them 5 to 10 years ago,
a few years ago then,
maintained their hair, held on to half of it, they could have had a full head of hair, because they only would have needed surgery for certain areas. So it's a shame. It's not wait until you've gone bald and have a hair transplant, because actually you probably shouldn't have one at all at that point.
No.
So kind of backtracking then, with any hair loss treatment, it's going to take 3 to 6 months to start to see progress.
Okay, 3 to 6 months.
And that would be ideal if we've got that in before surgery. It doesn't always happen that way.
No, because it's last minute bookings and that kind of thing.
Yeah.
But 3 to 6 months is ideal for if you're having hair transplant surgery.
Yes.
To get that PRP session in.
Exactly
before.
that, and any hair loss treatment.
Yeah,
so we're working to get the hair in the scalp in the best condition possible. We're strengthening and we're supporting blood flow to the scalp. So it could be PRP or any hair loss treatment, essentially.
They used to, I mean, this is something you'll be able to sort of correct me on this, but I had no idea that this used to be a thing back in the day before FUE or whatever.
Yeah.
That they literally used to like cut
I've sat in on FUT. That was the first surgery I ever
that is just...
It's brutal. So the healing is really rough. Like, they're in a lot more pain healing with FUT.
no wonder. Your scalp has literally been cut.
Exactly. And then it's really tight. So it was very difficult to get good outcomes with the scarring.
Yeah.
Because they're taking away some of the scalp, and it could have been like a slither, say like this. The way they described it to me the first day I was in on surgery is like, we're going to remove like the loaf of bread. Then it's going to get passed to the techs and they're going to cut it into slices of bread. They're then going to get a few slices each and they cut away the rest of the tissue. So you're still left with just the follicle. When they stitch the skin together, so it's been cut down here, when they stitch the skin together, obviously because it was pulled quite tight, often when it heals, the scar would spread. So you'd end up with like a white line.
A big,
that would be a massive giveaway.
Oh my gosh, so would you be able to like spot that on someone? If you were walking down the street and you'd like they've had...
So they would have to have, I don't know what you'd call it. What is this sort of length? Is that like grade 4, grade 5? You'd have to have it quite long to cover the scar.
To cover it.
If you had a skin fade, you would see the line.
You would see it.
Yeah, absolutely.
Wow. It's crazy how like technology's advanced, you know?
And the healing was brutal, because obviously I did book a few FUT surgeries when I first started,
Well, yeah, because if that's what was...
That was the technique.
That was the technique.
Was so new, actually. So the first surgery I ever set in on, there was actually 2 surgeries going on the day.
Yeah.
So I was in and out of an FUT and an FUE.
Swapping between them.
Observing both,
Wow.
Yeah.
That's interesting.
I had an elderly guy in and I saw he'd had about 30 years before that, the old style of hair transplants where they would cut circles. So there'd be a circle like that with a bunch of hair and then another one. So it's like a doll's head.
Absolutely
And he came in asking if we could do anything to strengthen and fill in the gaps. And I was like, no, because essentially you are bald. And then you've got these circles of plugs. They're called plugs at the time.
Hair's such a big thing.
Yeah.
People are really self-conscious about it. So then to think that you're going to have a great surgery and everything's going to be fine, and then you're butchered basically at the end of the day.
It's awful. And some bad surgeries can be very difficult to correct as well. Yeah.
Well, yeah, it's not an easy fix. That's the thing. Okay, so 360 Optimum Hair. This is your line of hair loss treatments. So if you can, we'll just go through them one by one and you sort of explain anything you want to explain about each product and tell us a little bit more about them.
Yeah, perfect. So I launched 360 Optimum Hair about 9 years ago. The reason I looked into having these made is because I'd already been in the industry for about 4 years at this point, probably 2 years when I started the process. And when you open a hair loss clinic, there were actually very few ranges of products available to offer in clinic. But I very quickly went through all of them because we would start using one. Some of them made the client's scalp a bit flaky. Some of it had made the hair feel nice, but when you looked at the ingredients, you're like, hold on a minute.
Really bad.
In training, this is everything I was told to avoid.
Yeah.
And then some of them, they had great ingredients on paper, but the hair would be brittle, it would be flaky.
So like the opposite. So like the ingredients would be good, but the hair feels horrible.
So nobody wanted to use them.
Yeah.
So I sought out to have my own products made. And at the time as well, there weren't as many ranges that were doing things like sulfate-free, silicone oil-free.
That's become like a popular thing now, hasn't it? To stay away from certain ingredients.
There are many brands that are much better at doing it these days, but at the time there wasn't so many.
No.
So yeah, if I go through them in order, if I start off with the shampoo and conditioner first. So one thing that I sought out to do straight away was for the discreet factor. Like, they don't say hair loss on them anywhere.
No.
They're quite plain intentionally.
Yeah, I like the packaging.
I've thought about kind of jazzing it up over the years, but the feedback is generally it's quite nice. They don't draw any attention in the bathroom. So that was really important.
I'll quickly touch on that.
Yeah.
That's probably quite a big thing because if you're self-conscious about losing your hair, the last thing you want is a shelf full of products that says, basically, help me get my hair back, right?
Exactly.
So that's good that you've sort of kept that away from the packaging.
Yeah.
And it just looks like
so
it would be...
optimum hair could be hair growth. It could be anything. Yeah, exactly that. So that was really intentional. And yeah, so basically, going from the basics of just like general hair care, it is great to be washing your hair with sulfate-free shampoos.
Okay.
Most of the time, because generally sodium lauryl sulfate is very stripping on the scalp. It can make the hair brittle.
On so many packaging.
Yeah, it is. So it's cheap. It's a very good degreaser. So if you think of like washing up liquid.
So your hair, you know that your hair's going to feel clean after it.
Yeah, but like squeaky clean and like your hair could snap. That's the problem. Yeah.
So that's the issue with it.
Exactly. And then most products, because they have SLS in it, they will then also have a lot of silicone and oils, so your hair doesn't snap when you rinse it off.
Okay.
The problem we have is those ingredients coat the hair and the scalp and leave residue and build up.
Yes, that's what I've heard, the silicones. I think is the really popular one, is it Pantene that is really bad for like silicone?
Anything you can get
is bad.
And this is the thing, because these are really expensive to make.
Yeah.
But they are cheap ingredients that make the hair feel okay, even though it could be damaging it long term. So they're like a quick fix, but not really good for the structure of the hair and for the scalp health. So yeah, sulfate-free, silicone-free, oil-free. That's great. That gives like a base of a good formulation.
Yeah.
Then we've got the growth stimulators. So in the whole range, we've got the best growth stimulator that I've personally come across is something called Capillia longa.
Okay.
So this is the main one. It is derived from the turmeric plant. So it's naturally, anti-inflammatory, it's hydrating.
That's good. Yeah, it's got like natural properties to it.
Exactly that. And then in the clinical trials, so Capillia longa was trialled alongside a 5% minoxidil.
Oh, okay.
And it outperformed the results in the first 5 months.
Wow, that's interesting.
Yeah, so I think when we start minoxidil, you get an increase of shedding. You don't get that with Capillia longa. So I think that's how it's able to outperform the results of minoxidil in the short term.
Yeah.
Long term, the results were quite consistent. So, these products can be used with hair loss meds, which we'll come on to, but even as a standalone hair loss treatment option for those that are not medically suitable for hair loss meds.
Yeah, true, because some people aren't.
Exactly, or they just don't want to use them.
Yeah.
These can be an alternative, or they are part of a plan with meds as well.
Okay, that's good to know that you don't have to use them alongside this sort of like medication. They're fine to use by themselves.
Exactly that. So yeah, the Capillia longa is there to keep the hair follicle in the growing phase for longer and shedding for less time. We then have caffeine that improves blood flow to the scalp, so it improves blood flow by over 30%. And going back to the stats for the capilla longa, so it was proven to reduce hair loss by 89%.
Wow.
And increase hair density by 52% within 150 days. So
wow,
5 months.
that's amazing.
So we always say this 3 to 6 months because it does take that time for the results to come through. There is also ginseng, honey locust, white nettle. Like they're really good for like reducing inflammation, balancing, clarifying the scalp. Vitamin E and wheat protein will strengthen the hair strands as well and hydrate further.
So again, these can be used after a hair transplant, before hair transplant, no matter where you are with your sort of hair journey. These can be used at any point.
Yeah, exactly. They're great for everything, as in scalp psoriasis, eczema, hair extensions, color treated hair. Exactly. So they're just great for anyone.
Okay.
So yeah, ideally part of a hair loss treatment plan pre-surgery, but also because of the capilla longa and the caffeine, it's obviously quite stimulating. So we go back to these from 2 weeks post-surgery.
Okay.
So, you know, some of our surgeons will provide the patient with aftercare shampoo. Sometimes the surgeon may just advise a baby shampoo. So we do stick with that.
Yeah, that's quite common, that one, baby shampoo.
So we do stick with that for the first 2 weeks because we just don't want to stimulate it too much in the healing phase. But yeah, from 2 weeks post-surgery, we go back to the shampoo and the conditioner. A lot of male patients or patients with short hair, generally long-term won't need a conditioner. Obviously, it's there to detangle. And it's that extra step that sometimes people don't want to use. However, in the first 4 to 6 months post-surgery, you know, when there's a lot of flakiness, dryness on the scalp.
Yeah, and you want to keep it sort of like nourished and hydrated.
Yeah, this conditioner can be massaged into the scalp. It's not going to leave build-up residue. It's not going to make the hair greasy or flat in any way. So yeah, and ideally, washing the hair every day or a minimum of every other day.
Okay.
Keeping the scalp nice and clean and clear. This even goes for patients with long hair, like it's a faff, and hair wash day can sometimes be like a whole evening. However, if we were purely focusing on faster hair growth, preventing hair loss, we want the scalp clean and clear. We want it as hygienic as we keep the rest of our skin.
So you would recommend doing it more than trying to, because I think some people would, it might sound silly, but they would automatically think, I need to wash my hair less.
Yeah, I hear it all the time.
I mean,
leave the natural oils on the scalp.
That's it. You see it all over TikTok and Instagram, don't you, with these wild things to try and help you grow your hair. But realistically, you should just wash your hair.
Yeah, exactly that. And with long hair, there has to be some balance with the heat styling, mechanical damage from brushing it. So you have to do your best to kind of really protect those ends as well. But if we're just focusing on scalp health and treating hair loss, it would absolutely be washing it more often.
It needs to be clean.
And these are gentle enough to be used every day.
Yeah, that's good, because a lot of stuff can be quite strong and harsh to the scalp and the hair. So if you think you're sort of damaging your hair by washing it frequently, you're not with these products.
Exactly that, yeah. And there's something to be said about a clarifying shampoo or something like a ketoconazole shampoo, like a Nizoral. Sometimes they do have their purpose and their role. So if you were only using these and never clarifying your hair and your scalp, you might end up with build-up. So jumping back slightly to silicones, they have their place.
Okay.
They wrap the hair strand. They provide like a slip and a protective
like a protection
barrier. Exactly. So you know your heat protectors, your serums. That's when I'm not opposed to silicones, because they're protecting the ends of the hair. And if you weren't, then once every 2 weeks or so, clarifying and using something stronger than these to strip it all off, you're going to get build up. Because these are not strong enough to be stripping silicones and oils off the ends of the hair. So I would say this would be like your foundation. And then using a clarifying shampoo once every 2 weeks would be perfect, along with like a mask or something.
Do you have any like recommendations of clarifying shampoos?
Oh, I really like at the minute one called Ouai, Ouai.
Yes,
I think it's spelled.
Yeah. Okay.
So
you'd recommend like that one?
Yeah. To just reset, you know, remove any build-up of the hair and the scalp.
Okay.
Another thing, particularly for male and female pattern baldness, would be something like a Nizoral, which has got ketoconazole 2% in it.
Okay.
So again, you know, if
I love how I'm just pretending I know what that is, by the way. Like, yes, I know what that is.
So if somebody has any scalp build-up, If they've got anything that looks like it could be turning a bit fungal, you would use it every day for 2 weeks.
Okay.
To get rid of that.
To get rid of it.
And then generally it seems to be quite a good thing to use maybe once a week or again every 2 weeks on the scalp for male and female pattern baldness. If you were using it every day, the hair would be so brittle though. So again, this is like your foundation and then your clarifying.
Yeah, stick with those and then every so often add to your sort of clarifying and all the others.
Yeah.
Okay.
So your Nizoral, your ketoconazole is going to stop like the overgrowth of yeast on the scalp. It also...
I didn't even know like that was a thing.
Yeah. So let's say you've got out of the shower, you are freshly squeaky clean. Even at that point, you still have like, we've got a skin microbiome.
Right.
So it's going to sound gross, but if you looked under a microscope, we've got creepy crawlies all over our skin.
No.
Sorry to say that, and on our scalp. Yeah.
Oh God, it freaks me out, but I would love to see it.
Yeah. And then, so basically this is why we should wash the scalp often. So again, the scalp secretes oil every day. It produces something called sebum.
Okay.
And that sebum is, testing my knowledge now, I think it's something like pH 4.5.
Right.
The reason it secretes an oil that is essentially slightly acidic is to stop the overgrowth of something like a microorganism turning into like a yeast problem.
Okay.
So when you're not washing the hair, you're actually allowing that to build.
To build up.
And you want to then strip that oil off and reset and keep it nice and clean and clear.
Oh gosh. It's freaking me out now.
So ketoconazole is like antifungal. So post-surgery sometimes if it's looking a little bit yellow, very spotty, maybe the start of like a folliculitis, often the surgeons will recommend 2 weeks of ketoconazole shampoo.
Using that shampoo. I have seen a few people get sort of like spots from after having a hair transplant, and they're obviously like, what do I do? What do I use?
It's so common. So after hair transplant surgery, it's very normal to have ingrown hairs.
Yeah.
Not even just where we've transplanted, but in the back.
In the back. That's where I had seen it before.
Exactly,
it was in the back.
So that's
washing
the
shampoo
hair
and conditioner.
Effectively. Yeah.
Okay.
We then have the follicle treatment. So this contains a higher concentration of the Capillia longa.
Okay.
So that turmeric extract that's keeping the hair follicle in the growing phase for longer and shedding for less time. By applying it in this way, so say on hair wash day, the hair's slightly damp, you part the hair, you spray it on the scalp, you massage it in, style your hair as normal.
Yeah.
On non-hair wash day, if you're doing every other, it's going on to dry hair, so it's going to make the root wet.
Yeah.
But if you massage it into the scalp, I did a video the other day. Obviously, I've got fine, fair hair.
Yeah.
So you would see anything in my hair. But it took 4.5 minutes with me ruffling my fingers for it to dry in.
For it to sink in.
And it was fine.
And it was fine. And it didn't
It's
look
not
greasy
sticky
or anything.
I've got loads of it in today because
it
was hair wash day.
Notice.
Yeah. It actually gives a nice little bit of root lift as well. So if you have got a finer hair type.
That.
Exactly. When you blow dry it in. Really nice. Yeah.
Yeah.
So the Capillia longa's in there, the caffeine, creatine as well, topical biotin. Again, so this could be cast as like your natural alternative to minoxidil.
So how many times would you recommend using the follicle treatment? Is it like a daily thing or?
Yes, absolutely. So ideally, application once a day.
Once a day.
So if you were using this standalone, it doesn't matter if you're using it morning or evening. If you're combining with hair loss medication, you would leave 4 to 6 hours in between applying them.
Right,
so maybe one in the morning, one in the evening.
In the evening, yeah.
Then we have the capsules. So these are like a nutritional supplement to support hair growth.
Nice, okay.
Some of the things in here you will see in a lot of hair supplements. So your biotin, your folate.
Yeah, I've heard of biotin's like the main one that I've heard of.
Yeah, B vitamins, zinc, copper. They're all at the right quantity specifically for hair growth.
Okay.
So in a multivitamin, you've got like a whole list of ingredients, but there's such a tiny bit of each thing. So we've got clinical doses of everything in there. Another couple key ingredients would be the saw palmetto. So this is sometimes referred to as an alternative to finasteride, but they do work in very different ways, and it's definitely nowhere near as strong as finasteride. So somebody should not stop taking finasteride to use this unless they're actively trying to come off it.
Right.
So what saw palmetto does is it's derived from like a Brazilian berry plant, so it's completely natural.
Oh, nice.
And it will seek out the receptors in the scalp to prevent the DHT from binding to it.
Okay, got you.
Yeah, so DHT is the male hormone causing hair loss in the first place. If somebody was taking finasteride, they're actually stopping the body converting testosterone to DHT.
Okay.
This is not doing that. This is just limiting how well it can bind to the receptors in the scalp.
Right, okay, so it's not stopping it completely from, it's just...
Yeah.
Yeah,
So it's
that
not
makes
as powerful as finasteride. However, for some people, depending on how aggressive the hair loss is, this could be enough for some people.
Yeah.
The only way you would know is giving it a go, and it would be maybe starting off on these. And if the hair loss isn't stable, we might introduce finasteride.
Yeah, if you need something a little bit stronger.
Exactly that. Or that would be somebody that's effectively trying to avoid meds if possible. For some people, it might be the choice to go straight in with finasteride and these, so they can be taken with finasteride.
Okay,
Or
that's good to
dutasteride,
know. Yeah.
which is another DHT blocker. We also have something in there called Anagain. So this keeps the hair follicle in the growing phase for longer and shedding for less time as well. So 3 capsules a day, ideally taken with food, because if you take anything with zinc on an empty stomach, it can make you nauseous.
You can feel a bit sick. Right, okay, so 3 times a day, ideally with food.
Yeah.
I guess breakfast, lunch, dinner then. That
Yeah,
makes sense.
or 3 with breakfast, or 2 with breakfast,
so you can
1
take
with
them
dinner.
all at the same time.
Yeah, you
right,
can
it doesn't
do.
have to be spread out through the day.
No,
Okay.
either or.
Okay, so moving on from 360 Optimum Hair, let's touch slightly on finasteride and minoxidil.
Yeah.
So we've obviously talked, we've got quite a few videos on our Instagram and social medias and that kind of thing about finasteride and minoxidil. However, we haven't talked a lot about the side effects, and I know a lot of people want to know that. So can you share a little bit of insight into sort of the side effects of both of those medications?
Yeah, absolutely. So if I just touch on how both of them work, and then it will kind of make sense what the potential side effects could be. So to start off with minoxidil, so that's a vasodilator. So it was actually discovered by accident years ago. It was given to patients with high blood pressure. And they discovered a side effect of that was that it helped with hair growth. So
So it wasn't even meant for that.
No,
right.
exactly that. And eventually, due to that, so it was given to patients with high blood pressure in oral tablets, and they developed a topical version that was then FDA approved as a treatment for hair loss, as a medicine for hair loss. So what it does is it widens the capillaries and allows the blood to flow more freely. So by doing that, the pressure drops in the blood. So blood's flowing more freely, which allows more oxygenated cells and nutrients to the follicle. And they don't actually really understand the method of why, but it does keep the follicle in the growing phase for longer and shedding for less time. So therefore, it can potentially lower blood pressure, cause rapid heart rate, tachycardia, headaches, weight gain, and also more hair growth.
I need that.
Yeah, also more hair growth everywhere. So on the face, the body. So it's not often,
just the head.
No, so it's not often like a first port of call, particularly for female patients. But it can be a good option. Like I say, as long as you're medically suitable. So if someone had any heart conditions in the family,
I was going to say,
probably be a no.
What would make them not suitable?
That would be the main one, to be honest.
Okay.
Yeah. And if somebody does experience unwanted side effects, they can actually go in the first 6 weeks once the body adjusts.
Oh, right, okay. So that doesn't necessarily mean that they're always going to have that side effect.
No. But if it doesn't even out over the first 4 to 6 weeks, then the advice generally would be to come off it.
To stop it.
In topical formulations, it can also be common to get a bit of dryness, itchiness. There can almost be not quite an allergic reaction, but it can be quite irritating on the scalp.
Yeah.
So that depends on the quality of the formulation and what brand, etc. is being used.
So you'd have to have a little test around and see which ones work best for you.
Yeah, exactly that. With medications in particular, and things like minoxidil, it's not a good idea to just kind of test and trial things out.
Okay.
As like for a short-term cause of hair loss, or deciding, I'm going to take it for a month and just see if it does anything. So with minoxidil, the follicle tends to become reliant on it.
Right.
So once you start using it, if you were to stop using it, it will cause more hair loss and shedding.
Okay, yeah. So unless you're going to take it for a longer period of time,
with
there's
the intention,
probably no point.
No.
Okay.
Because if you start it, there's shedding in the first 3 months. That actually shows that it's kicking out one of the good hairs to grow the next one.
Right.
It's kind of pushing the follicle into the anagen growing phase.
Yeah.
And so you're going to have shedding in the first 3 months. If you're then starting to get some progress and then you run out after 6 months, so you just stopped, the follicles then go into shock loss, so you have a lot of shedding. You're probably going to be worse off than if you hadn't started it.
Yeah, exactly.
So if you go down that route, it's super important to be really consistent.
Stick with it.
And sometimes that puts people off, you know, when they say, I have to use hair loss treatment forever. But you know what? Like, regardless of which hair loss treatment option you go for, you should use it forever anyway.
Yeah, because I always see that, and I see a lot of the time people comment on our videos and things saying like, yes, but you have to use it forever. And I'm like, well, if you want hair forever,
exactly,
then Yeah, you do.
Yeah.
Like, that's kind of just how it goes.
Exactly that. And like you brush your teeth hopefully twice a day, hopefully you
Forever.
shower every day. Like you do
Exactly.
these things.
Yeah.
And as long as you're not having unwanted side effects and you can fit it into your routine, just do not be inconsistent and don't take breaks. Like order your medication before you've run out. Like don't go windows of time.
But I guess that's the same with any type of medication. Like you wouldn't just, for us females, like contraceptive pill, I would never just leave it 3 months
No,
and
exactly.
then not.
Because your hormones will be all over the place.
Exactly, exactly. So it's just one of them things. If you're going to use it, then don't be mad that you have to use it for a long period of time.
Exactly. And
that's
also,
how it goes.
male pattern baldness or female pattern hair loss is progressive. Nothing's going to switch it off. So if you have a hair transplant, yes, the new hairline's going to grow in, for example, but nothing has switched off that hormone that's causing your hair loss in the first place.
Exactly.
So if you want to start this and go down like this route, then just be committed to some form of hair loss treatment plan, whether it's medication or not.
Yeah.
So that's minoxidil. If somebody is experiencing like dry, flaky scalp, maybe an oral version might be best suited to them.
Okay.
Or,
so the other option is it's a spray, isn't it?
Yeah.
The minoxidil.
Yes, it could be spray, could be a foam.
Okay.
Topical or tablet is oral. Yeah.
Right. Okay.
So yeah, when you take it orally, you could potentially increase the risk of side effects because it's more systemic. But even when you apply it to the scalp, it still gets into the bloodstream.
It's still going into your system. Yeah.
Exactly that. So that's minoxidil. Finasteride is completely different. This works on your hormones. So minoxidil is working on blood flow.
Okay.
Finasteride works on the hormones. So the cause of androgenic alopecia, male-female hair loss, is testosterone converting to dihydrotestosterone, which we call DHT for short.
DHT, yeah.
DHT binds to the receptors at the top of the scalp only, so it doesn't bind to the ones at the back of the head.
Right.
That's why we use them in surgery. And then it causes the hair to thin. When you take finasteride, it's called a DHT blocker. So it blocks the enzyme from converting testosterone to DHT.
To DHT.
So you've got no DHT or very little of it in the body. So you're literally removing the thing causing the hair loss in the first place. Now, potential side effects with that one could be erectile dysfunction, lowering of libido, anxiety, gynecomastia. And this is due to that shift in hormones. So if you've still got testosterone and it's not converting to DHT, more of it converts to estrogen.
Yeah, because it has to go in a different direction.
Exactly that.
Okay.
Yeah. And then that balance of high testosterone, no DHT, and higher estrogen is associated with those side effects. And it could be anything from somebody not having any side effects. It could be mild but manageable, and somebody deems that worth it for their hair.
Yeah.
It could be that it interferes in day-to-day life and actually they'd prefer to come off it.
Yeah.
Okay.
Okay.
And you can get that in topical solutions, which in theory would reduce the risk of side effects because it's topical.
Yeah.
It's more effective when taken orally. And
I was going to say, I mean, it's similar to a lot of stuff. It is going to be more effective that way.
Exactly. Yeah, and you can combine. So minoxidil and finasteride is quite often generally recommended by all hair transplant surgeons.
Okay.
But if somebody is not medically suitable for those medications or they are actively seeking to avoid them, then it's just making sure some hair loss treatment plan is going on. 360 Optimum Hair Products, PRP.
Anything is better than nothing.
Exactly that. Yeah, and whatever it's taking. Yeah, and whatever it's taking for that patient to get their hair loss stable. For one patient, it could be just these products on their own.
I mean, everybody's different.
Yeah, and for some people, this plus minoxidil, finasteride and PRP only cuts it when they throw everything at it.
Yeah.
So that's what you find out when you start hair loss treatment. You assess every 3 months. And we find what works for you, basically.
Yeah. So like with minoxidil, is there anybody that wouldn't be able to take finasteride? Is it similar?
So not if you're trying to conceive.
Okay.
It should be out of your system for a minimum of 2 months before trying to conceive.
Right.
Because if the partner fell pregnant and the fetus was a boy, it could affect how their sexual parts develop.
Okay.
So like a pregnant woman shouldn't even touch a tablet. Yeah.
So that's quite important.
Yeah. I have met people that have conceived by accident or even intentionally on it before and everything seems to be fine, but it's a high risk.
Yeah, so just in case if that's what you were.
Generally, the advice is if you get it out of your system for at least 2 months. Some other countries suggest 6 months. I've heard other countries suggesting 2 years.
Wow.
In the past.
Wow.
So it's just whether it could have an impact or not. But generally, I think 2 months. And if somebody stops it for that time, the medication actually stays present in the tissue. So usually you won't lose too much hair just stopping it for those 2 months.
But that period of time. Yeah, if they've been using it for like long enough.
Yes.
It's kind of built up in a sense.
Yeah.
Is that, yeah?
Yeah, exactly that.
Okay, so you started off in your clinic with laser therapy. So what is laser therapy?
So low-level laser therapy is a type of red light treatment.
Yeah.
Which is amazing these days. It's a lot more talked about. But when I started, nobody knew what that was. You get infrared saunas. We see these face panels. We see
Yes, I
face
see them
AEDs,
everywhere.
all sorts of things. To treat hair loss specifically, it's a certain wavelength. So it's 650 nanometers, and it needs to be laser therapy. There are so many devices online. I mean, companies approach me on a weekly basis to promote their
I'd
products.
say like sell in your clinic.
And 9 times out of 10 I look and it's an LED spec. So LED diodes do not do the same thing as laser diodes.
Okay.
The wavelength will not penetrate the skin in the same way.
So it's almost like not as strong.
It's like a knockoff of
And
laser
a
therapy.
literal knockoff.
Yeah. And unfortunately it looks the same. So you might be putting this red cap on and you might see these red lights and you think it's doing something, but it's really
It's not.
No.
Yeah, I think you see the red lights and you think, oh, it's doing something to me because it's red and it's on my skin. But
yeah, exactly that. So most of the cells in our body contain something called a mitochondria. And that's like the battery
I feel like
pack.
I heard that in like
School? Yeah, you would have done, you
yeah.
would have done. So imagine the mitochondria is the battery pack of the cell.
Okay.
The job of the mitochondria is to produce ATP energy. That energy is then used for one cell to duplicate and produce another. So it's like the energy currency.
Okay.
Yeah? And that's how hair cells are produced. One cell will duplicate and produce another.
Yeah.
In the hair follicle, it works its way up the hair follicle until it produces your hair strand.
Okay.
Yeah? So when you're sat under this type of wavelength specifically, it will charge that battery pack and make it perform better. So the mitochondria is now producing a lot more ATP energy than it was doing naturally. And then that speeds up the production of hair cells. So it's producing more hair cells at a faster rate.
Okay.
Also, these kind of lasers, they're already used in hospitals for more than 50 years for wound healing. So,
wow. Oh yeah, I guess because if it's the same with a follicle, it'd be the same with like a skin cell.
Exactly that. So very good. Obviously, pre-surgery, you're improving blood flow to the scalp, which is amazing. And then post-surgery, you're helping the wound healing as well.
Right, okay.
So ideally, for all of my local patients, we start laser therapy from 2 weeks post-surgery.
Right.
Because, you know, the scabs are gone, everything's healed.
Yeah.
And you've got that residual pinkness, haven't you, for months?
Yeah, it is.
Which everyone hates.
Yeah, they do.
Yeah, so we're speeding up the healing. And the laser therapy at the same time is thickening the thinning hairs that will be there around the transplanted area.
Yeah, I guess because you mentioned like wound healing. Technically, like they are little wounds, aren't they?
Yeah.
So it would work both ways.
It does. Yeah, the wound healing, thickening thinning hairs, and then encouraging the newly transplanted hairs to grow back quicker after they've shed.
Yeah. Interesting. Okay, so will you give us a slight timeline of when to use the products, either before your hair transplant surgery or after?
Perfect. So, I mean, with all of the hair loss treatment options, it would be great to be using them for a minimum of 3 to 6 months pre-surgery.
Pre-surgery, yeah.
Even better if you've been using them for 2 years, 5 years, 10 years, it doesn't matter.
Yeah.
But just if your hair loss is stable, that's a really strong position to go into hair transplant surgery. So let's think about these in order. So from 2 weeks post-surgery, when the scabbing is gone and you have finished, like we've signed you off on your group chat, and you have finished those initial kind of aftercare steps.
Yes, because that's the initial after sort of healing process, isn't it?
Exactly that. Yeah. So at that point, you can go back to 360 Optimum Hair shampoo and conditioner from 2 weeks post-surgery. We can also start laser therapy from 2 weeks post-surgery.
Oh, so you can do that similar time.
Yeah. You can take the capsules from 2 weeks post-surgery and also finasteride.
Okay.
That covers all of those.
Yeah.
From 4 weeks post-surgery, you can introduce minoxidil if you're going to be using it. You can continue with PRP. A lot of patients have one in surgery.
Yeah, they do. Yeah.
So from 4 weeks post-surgery, I think that covers all the treatment options.
Right, everybody. Well, I think that covers everything that we want to cover. Thank you for joining us today, Sophie.
Thank you so much for having me.
Yeah, it's been great. I think it's important to note that any of our clients at Want Hair. If you feel like you need any extra help, then you can always book a consultation with Sophie and have a chat with her if there's anything that, you need help with, or even if they've got questions to ask you about your product.
Exactly.
But if it's something quite simple, she does also have her TikTok account, which I know is quite popular. So is that, what's your TikTok handle? Is it That Hair Loss Expert?
Yeah.
So it's That Hair Loss Expert. You'll recognise her with a blue tunic on. So anything that you need help with or answering any questions, the majority of the questions will be answered on there. But yeah, she's always there if you need any help. And thank you so much for joining us today.
Thank you.
Thanks, everyone.